Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Ten top homeopathic remedies for peritonitis. What is peritonitis? Before defining peritonitis, let us first know what the peritoneum is. Picture 1. I will explain. The peritoneum is a double layer tissue. One layer called parietal layer covers our abdominal cavity. The other layer called visceral layer covers the organs of our abdominal cavity like stomach, liver, spleen, part of intestines. When due to some reasons peritoneum is inflamed, the phenomena is called peritonitis. Now look at the picture 1. This blue line covers the exterior or abdominal cavity line. These are cavity line, abdominal cavity line. So this is the parietal layer, and this red or orange color layer, these are covering the organs. It is visceral layer. It is very difficult to understand actually from picture because this is a three-dimensional thing. It can only be clearly understood by seeing the abdominal sections, that is during surgery one can understand it, or during dissection. Yeah, anyway, let us know that the whole abdominal cavity, there is one external covering and another internal covering. External covering covers the lining of this abdomen. Internal covering lines the various organs such as liver, names are given here, liver, spleen, etc. etc. And inflammation of these layers is called peritonitis. What are the causes of peritonitis? Main cause of peritonitis is infection by microbes, bacteria, virus, etc. However, the following events bring about peritonitis: injury and infection to stomach. Picture 2. 1. Peptic ulcer. There may be various things. One example is peptic ulcer. There may be injury also. Liver, pancreatitis. Picture 3. This is healthy pancreas. This is inflamed pancreas. From this inflamed pancreas, inflammation may spread all over this peritoneum. So it is peritonitis. Burst appendix, another very important common symptoms. Digestive problem like Crohn's disease. Picture 4. This is Crohn's disease picture. Internal microscope picture. Diverticulitis. Diverticulitis is the lower end of the intestine, large intestine. There may be diverticulitis. They also create inflammation. These things outside. Following surgery, that is modern medicine surgery. After modern medicine surgery, there may be peritonitis, and it is a very common cause of peritonitis following surgery. Pelvic inflammatory diseases. There are various pelvic inflammatory diseases. From there also peritonitis spreads. What are signs symptoms of peritonitis? Abdominal tenderness and bloating, stomach upset like diarrhea, nausea, vomiting, fever and chill, loss of appetite, reduced urine, thirst, severe restlessness and weakness. What are types of peritonitis? Primary peritonitis, spontaneous bacterial peritonitis seen in patient with chronic liver disease. That is, the patient who are admitted in hospital with chronic liver disease. When they are affected with peritonitis, it is called primary peritonitis. Secondary peritonitis, most common found in clinical practice. That is, a doctor in chamber or a doctor in the outpatient department of a hospital gets patient, and he, according to his clinical testing, comes to know that this patient is suffering from peritonitis. This is secondary peritonitis always. Tertiary peritonitis develops in absence of original visceral organ pathology. That is, there is no visceral organ pathology, no pathology of liver, no pathology of stomach or spleen, yet peritonitis is there. It is tertiary peritonitis. Each peritonitis is a grave situation? Yes, it is a grave situation and a medical emergency. Unless attended promptly, it may be fatal within 1 to 2 days. Now, here I will request my viewers about homeopathy here. You see, homeopathy has less medical emergency tackling technique. So whenever you get such a patient, you give him or her medicine, but also instruct him to contact nearby hospital or nursing home immediately if the situation slightly worsen. Mind it, this must be instruction must be given to your patient not only orally but also in your prescription. You will write down this. Please contact nearby hospital or nursing home if the case slightly worsen. Then you are relieved of your responsibility, because these emergency tackling problems, emergency tackling techniques are not there with us, or with generally in hospital, in homeopathic hospital there may be some this is available. I mean, this drip, food through Ryle's tube, feeding of food through Ryle's tube, problem of giving drips, or these are in homeopathic hospital it is available, but in chamber generally it is not available. So you please instruct in that way. Who are at risk for peritonitis? Patients with chronic liver disease, patients having fluid in abdomen, patients with weak immune system. That is, this type of patients are vulnerable towards this disease. Each peritonitis is a preventable disease. If it is a case of peritoneal dialysis, on the right hand side, an image of peritoneal dialysis is shown. The peritoneal dialysis going on here. You know, dialysis, when the kidney cannot purify the blood, this is required. Artificial clearing of toxic things from blood. This is peritoneal dialysis. This also cause of peritonitis may come from this also, but if it is a case of peritoneal dialysis, one may prevent peritonitis. It is preventable with good hygiene before, after dialysis. Hygiene means just keeping things, hands, etc. clear, aseptic, antiseptic. In general, it is hardly a preventable disease. That is, in general, it is not a preventable disease. It generally cannot be prevented. It may occur at any time. Now we are taking homeopathic remedies. Aconitum, that is Aconitum napellus for peritonitis. High fever, terrible anxiety, acute pain in abdomen and history of attack or catching cold. 3. Potency 3, 1 hourly. In case of no result, sulfur 30, 4 hourly. Mind it, the peritonitis is almost always an acute disease. Cancer is for peritonitis. Acute pain in abdomen but no fever. During urination, severe tenesmus. Cancer is 3, 1 hourly. Belladonna for peritonitis. High fever, pulse full bounding, heaviness in head and chest, abdomen swollen, vomiting of bile. Belladonna 6, 2 hourly. Carbovage for peritonitis. In last stage of the disease with copious cold sweat, cold breath, cold tongue, voice lost, with desire to be constantly fanned. 30, too early. Arsenicum for peritonitis, arsenicum alb actually, severe weakness, burning in abdomen, repeated thirst for small amount of water, cold sweat, worse from drinks or foods. Arsenic 30, 3 hourly. Lycopodium clavatum, lycopodium in short, for peritonitis. Too much wind, bloating, constipation, urine red, pain moves from right to left. Lycopodium 30, 3 hourly. Lachesis for peritonitis. Abdomen hot, touch intolerable. Too much pain in abdomen, numbness from waist to thigh. Worse after sleep or cannot go to sleep. Lachesis 30, 3 hourly. Ars iod for peritonitis. If patient suffers from tuberculosis, that is then only ars iod is used. 3x 2 times daily. Mark Core for peritonitis. Tenesmus of rectum, not better by passing stools. Incessant, persistent. Terrible cutting and colicky pain with tenesmus of bladder, with intense burning in urethra, stool urine both, hot, bloody, scanty. Mark Core 6, 4 hourly. Colocynth for peritonitis. Agonizing pain in abdomen, causing patients to bend double with restlessness, twisting and turning to get relief better from hard pressure. Pain worse after eating or drinking. Patients extremely impatient, irritable, throws things away. Colocynth 3x, 2 hourly. With this, the video ends. Thanks for listening and viewing. If you face any problem, any question, anything, please write down in the comments. I will certainly attend.